Hello, everyone, and welcome back to normally mine and Fran's podcast, but I'm here with a different group today. So, welcome back to our podcast, IPC in Action. We don't have Fran today, but I do have three other lovely guests. So I'll go around the room for people to introduce themselves. So, Leslie, do you want to explain your job role and your name, please?
So my name is Leslie McLeod-Downs, and I'm the lead nurse for IPC in care homes.
Lovely. Reggie?
Hello, everyone. My name is Regina Kageni, but everybody calls me Reggie, so you can call me Reggie as well. I am the primary care IPC lead nurse for the ICB. I look after GP practices.
Eve.
And I'm Eve Spires. I'm lead nurse for infection control at the Acute Trust.
And Eve is regretting deciding to come along today.
Absolutely.
So we've got this special edition podcast today to get the sort of as much of the system as we can, the system being our sort of ICB colleagues as well as the Acute Trust involved, because we have celebrated Earth Day yesterday on Monday the 22nd of April. And we, as a One Gloucestershire System, want to reduce our glove use, and we're doing that as a system-wide approach. We have our lovely system colleagues with us, and we just wanted to have a little chat about how this can be applied both in the Acute Trust and in care homes with Leslie, and also in GP practices with Reggie. So thank you so much for coming on the podcast. And so we were just going to chat through. We've got some of this sort of infographic data, which will be available on coming through all of our comms. Sort of ICB colleagues, are you going to be able to distribute it as well?
Yes.
So you'll have it as posters and as maybe screensavers and things like that.
And on social media as well.
Oh, yeah, perfect.
Yeah.
Perfect.
Yeah.
So one of the things that we're going to try and do is sort of reinforce when to wear gloves and when is not appropriate to wear gloves, with the aim being that we can reduce our glove use in the system by 30% in the year 2024-25. And we accept that that is quite a big goal. What do you, how are you going to start with this in the care homes, Leslie?
Well, I love a big challenge, so I'm up for this, and I think it's a really good goal. Mm-hmm. What I love is that collectively as a system, we've been working together, and I love our catchphrase of gloves don't protect you, clean hands do. Mm. And I think there's so much we do in care homes that clean hands are the answer. Mm-hmm. So if you think of just putting a gentle hand on somebody's back who needs encouragement. During COVID, the unfortunate behaviour that sort of developed was people would want to put on gloves. Mm. And if you think about that patient, they would much prefer just an ordinary human clean hand touching them. So there's a lot of things that we can think about in our normal interaction in care homes where we could perhaps get rid of the gloves but approach it with a clean hand. And the specific project that we are doing, for this campaign, and what we must also remember, we've got Hand Hygiene Day, which is also about
absolutely,
the clean hands, not the gloves when it's inappropriate. And in care homes, what we're focusing on is our meal times. So sometimes it's culture, and this one, I think, goes back to when I was a student nurse, and I've been nursing for a long time. And nurses started to wear aprons to serve meals. But material aprons became plastic aprons, which is really not appropriate. Mm-hmm. And then in COVID, people added gloves. And if you think even of a Michelin star restaurant, if you go there, if they came to serve you at your table in plastic gloves and apron, you'd think, what's wrong in the kitchen?
Yeah, when you'd feel like you feel that you're being treated as a different class of person, don't you? You feel a bit dirty, which isn't a nice way to feel.
So what we're really encouraging is that at this time, care homes start to think about their practice and challenge themselves and think, how can we move away from the plastic gloves and aprons? And if you are wearing an apron to protect your uniform because you're the person, serving the meals, maybe an old-fashioned tabard or material apron, which you can wash after each meal, it could be used. But ditch the plastic.
Absolutely.
Clean your hands and ditch the gloves.
Love that, ditch the plastic.
Yeah, it's a nice sort of catchphrase, isn't it? Just sort of reinforcing when we do need to wear gloves, because there are plenty of occasions where it is appropriate and it is required, and I think this would be the same across the whole system, but please stop me if it's not, is on any risk of exposure to blood or bodily fluids, people need to be wearing gloves then. When coming into close contact with infectious patients, and the use of certain chemicals. Like I know in the acute trust, for instance, our domestics need to wear gloves and PPE when they're making up Fuse, which is one of our cleaning products that we use. Are there any other instances that might not be, that I'm not thinking of because I'm more acute trust focused?
For us in GP practices, we think about when administering harmful drugs like chemo drugs, etc.
Yeah, that's a good
So
point.
people would have to put their gloves on when doing that. Also, carrying out a risk assessment, and then wearing gloves if the risk assessment suggests that you do. So we advocate for, think about what you're doing before picking up a pair of gloves to put on. There are lots of different other ways, so say receiving a urine sample when the patient brings it in reception. So actually there are gloves there already for people to wear, but it's thinking about, do I actually really need to wear gloves? Because the urine sample is presented in a nice, clean, clear bag, so you're not really coming into contact with that bodily fluid. And so risk assessing is the way we kind of encourage everybody to go and think about what they're doing really before using the gloves.
Can I just ask, with that risk assessment, does it need to be like a formal approach, or can it be like just thinking about it in your head, a more informal approach?
Not really formal, just thinking about it in your head.
Okay.
And this could be the GP, the ladies or the guys in reception, or the practice nurse, anybody in the practice.
Okay.
So thinking about what you're doing and risk assessing, thinking, as you say, am I coming into contact with any blood or bodily fluids or non-intact skin or the mucous membrane, etc. So it's just thinking about it in your head.
Just
really.
having to think about it, and it doesn't have to be this formalised, written down risk assessment.
No.
Just applying a nice bit of common sense to the approach.
Yes, exactly.
So what we're thinking about when we want to reduce people wearing gloves inappropriately, that was not very well articulated, when not to wear gloves, what we see a lot in the hospital is people wearing gloves inappropriately when taking patients, for instance, down to scan, if they're on a wheelchair, or even transferring them in between wards. People will quite often wear gloves when doing that, and it's entirely unnecessary.
Absolutely.
And that's something that we really want to focus on, is those patient transfers. Something that we also see a lot when we're sort of going around all the wards is you walk into an area and somebody will be quite often on the phone wearing gloves, and it's a bit of a bugbear of ours, isn't it? That then whatever was on that glove, even if it happens to be clean, is then just transferred to the phone.
Yeah.
And I think people think, I've got gloves on, I'm now invincible. And it's sort of completely unaware that it's not being used appropriately at all. And it doesn't make your hands invincible, does it?
It doesn't at all. And again, like you're saying, that risk assessment for everything that you do has got to be in place, in the trust, in the care homes, everywhere. Just that thought of, do I actually need these gloves? Why am I putting them on? And I think it's just asking those questions time and time again. Why am I doing this? What is it for? And how is it going to protect me?
Yeah.
Because again, like you say, you put your gloves on, there really isn't the need to wear them on numerous occasions, as we've just gone through.
Yeah. One thing that's just popped into my head is seeing assessments taking place with patients, and it might be, for instance, a therapy assessment, and you see the therapists are sometimes wearing gloves, not all the time, but sometimes, and it's rarely, would I say, appropriate, and it also can make our patients feel like there's something wrong with them, like people need to protect themselves against them, and that's not a very nice way for them to feel. It's quite impersonal as well, isn't it?
I think one of my bugbears is what you've just mentioned, when you see people that have moved from one activity to another wearing the same gloves. So they've, for instance, been with a patient and now they're answering the phone with a pair of gloves on. That is usually should be a trigger that the gloves should be off, because it's one activity, one patient, one pair of gloves. So if you're finding you're moving between people with the same gloves, it's usually that those gloves shouldn't be worn.
Absolutely.
Those are ideal times for washing your hands,
Yeah.
having clean hands, gelling between, but don't use gloves.
Yeah, absolutely.
But it's using those gloves appropriately through one, for example, like when you do a bed bath,
Yes.
to make sure that in between different areas of the patient's body, you are actually then changing those gloves or removing them. You know, do you need gloves to wash somebody's face? Yes, you may well for other areas that are more personal, but for the rest of it, you actually don't need those gloves on at all. And again, I've seen people do a bed bath and then clean somebody's teeth with the same pair of gloves on. Now, how many times would people go to the toilet and then clean their teeth without washing their hands? None of us would do that at home. So why are we doing that to our patients when they're within our trust? So it's the care act, like you say, Leslie, it's one episode of care. It's not a whole episode of care. It's just that one episode of care when you actually need those gloves that they should actually be on.
I agree with you.
Well, and I really liked Leslie's thinking about it in a world relatable concept that, you know, in a restaurant, you wouldn't have somebody come and remove your plate or take away your plate after eating with a pair of blue vinyl gloves on.
No.
You know, it's a horrible thought, but yet we seem to do it quite a lot in hospitals and in care settings, that when we're giving out food or when we're feeding somebody or clearing away their cups or their plates when they've finished a meal or a drink, that people will quite often wear gloves, and it's not necessary.
Yeah, and that's why I think education is key and raising awareness, as we are doing today. So reminding everybody when it is vital to wear gloves. You know, so I think when you know when you should be wearing gloves, then you won't wear them if you don't need to. So, and I think the use of gloves has risen exponentially since the pandemic. And I think we've got so many gloves around, they're easy to kind of access.
Absolutely.
And so we just pick as we go, you know, on the phone, or even kind of taking patients' history. Sometimes we see people wearing gloves, writing stuff down.
Even using the computer, tapping away on the keyboard.
Yeah. And so I think education is key, and knowing exactly when you need to wear gloves.
How are you delivering that education in the GP surgery, aside from this podcast, I mean?
So we have quite a lot of distribution lists, so
Okay.
emails, and going out in person as well, speaking to people in person. So we have a lot of IPC lead nurses in GP practice. I mean, every practice has a lead nurse.
Yeah.
And so we communicate with them regularly because they're the ones, you know, out in practice, interacting with other people, etc. And so we send out a lot of kind of comms out to them, posters and education material, etc. And also we do webinars.
Oh,
So
amazing.
we have
Yeah.
sustainability-focused webinars, and we'll talk about it later, but we talk about gloves and waste, etc. But yeah, so word of mouth, also being visible,
Yeah.
you know, because I think if you send an email to somebody or send a poster and they don't see you, it's not as effective as when you're speaking to them in person. And so we go out in practice regularly and we talk to people at large. Most places have what they call PLT sessions, so protected learning time. So they shut the practice, say from 1 p.m. until 4, and they have training and updates, etc. So we get invited regularly to PLTs, and they do them per PCN, so primary care networks, and it's very well attended. So we use such opportunities to address kind of a big group of people and talk about what we're talking about today and other things. So.
That's amazing. There was quite a lot of that I didn't know. Did you, Eve?
No, I didn't know that either.
It would be great if we could deliver a slightly more sort of structured approach to our IPC focused learning in the trust. We used to have sort of quarterly teaching sessions for our link practitioners, and we are certainly looking at getting back to something along those lines.
It would be really good if we could get the link practitioners more training, because again, then the message is more widely disseminated.
Yeah.
Get my words out right. More widely disseminated to a lot more people. So again, that's what we want. We want everybody to know what they're supposed to be doing, not just the select few, really, don't we?
Yeah, and another thing as well that we have within GP practices is we call them sustainability champions. And so these are, say, practice managers, GPs, anyone really working for the practice, and they are the advocate. And we speak to them regularly. So they kind of push the messages on and spread the word about the projects that we are doing. And these guys are vital in, some of the things that we are doing, sustainability related, really. And we didn't have that before. It's a very, very new thing, and it's helpful. We are seeing benefits already because people are more aware of what they're doing. They're thinking about how can we reduce waste, how can we be more green in our practice, etc. Yeah, so sustainability champions is another way that we are spreading the word.
Yeah.
Yeah.
Amazing.
And again, we do have sustainability groups within the trust, and we now have our own from an IPC perspective. So we have a sustainability group, which we're now looking at all the things IPC that we can actually change or review or make a difference to, the world as a whole and make it a better place. So yeah, we have that input at the moment, which will be good.
Amazing.
And that is a system-wide group from ICB, community colleagues and the Acute Trust. We want as many people on that as possible. So anyone listening, you are very, very welcome to attend. And we are not the enemy to sustainability.
Definitely not.
We like to advocate for PPE use, but we also want it to be done in an appropriate manner and in the most sustainable way possible. So that sounds great. We do have some sort of some infographics with some information on the data, and it's not perfect data because this only applies to the Acute Trust and our community hospitals. So care homes and the GP surgeries, they're not included in this data. But in the years 23, 24, we used 10.7 million gloves, which is just insane. That's single gloves used in a year, which is equivalent to 260 tonnes of CO2. And that didn't mean a huge amount to me. So before we did this recording, we Googled what that's equivalent to.
Yeah.
And I got a nice little list. So it's 2.5 blue whales.
Whoa.
Wow.
Yeah, that's quite a lot. 45 elephants, 150 cars, and my favourite one was 1,000 pigs. I'm assuming that's adult pigs.
Adult pigs.
And what it also equates to is 1 tonne is equivalent to 2,500 miles in a petrol car. And so the amount of gloves that we used and the amount of CO2 that was produced as a result of that is the same as 388 return trips by car from Land's End to John O'Groats.
Gosh, that's a lot.
That's a lot of trips.
A lot of travel.
Yeah. So our aim is to reduce that amount by 30%. So we want to reduce the amount of gloves used across the whole system by 30%, which is quite a big ask. But I think before we came on, one of our colleagues had said that 1 in 4 opportunities to use gloves are inappropriate.
Wow.
Which was quite a sort of stark realisation that there is a huge amount that we can do around behaviours and around education that will hopefully essentially do that reduction for us, and we can hopefully smash our 30% reduction target.
I think that's doable.
I do too.
I think that's doable.
I do too.
I'm optimistic. So
Me too. I think we can do it.
I think so too.
And while we're not part of that data, what we are doing from June, both in GP practices and care homes, it's actually been led by you, Regina, so maybe I should hand over to you. But we're doing a project where we are looking at our glove and our
Tiger waste.
tiger bags,
Yes.
our waste bags,
Yes.
and seeing if we are using them appropriately and what the quantities are.
That's
So if we came back in a year's time, before the next Hand Hygiene Day, we'll have that data for care homes and for GP practices.
Yeah, definitely. Well, we'll have you guys back on for the next one then. That would be great. So, yeah, just on the sort of sustainability focus, we've got a couple of other projects like Reggie and Leslie have already alluded to. We're also doing a similar thing with our tiger bins in the organisation. We have a few areas trialling the use of tiger bins to reduce the amount of clinical waste that we're producing. Same with couch roll. Couch roll in GP practices and in the acute trust and the community trust. I think we're only doing... Are we?
I think so.
Okay.
We all use them. Yeah.
We're trying to stop using couch roll in sort of GP surgeries and outpatient departments, and instead just using just one clean examination couch that just gets cleaned in between use.
That's right. So for us in GP practice, this project, the couch rolls project, is underway, and it's not possible to stop the use of couch rolls. We've tried, but there's been a lot of resistance. So what we're doing is advocating for reduction of unnecessary use. So again, going back to what we said about glove usage, so using gloves when you are coming into contact with blood or bodily fluids, etc. So just asking people to, again, risk assess and think about, what they're using the couch roll for. And so we are, first of all, focusing on reduction of unnecessary use, and then hopefully, eventually, we will stop use completely. Yeah. And it's gone really, really well. I've got some figures, but I just need to kind of round up and give similar kind of example. And yes, it's working well. We've done posters, so every time I go to a GP practice for an IPC visit, I'm always looking around to see what they've got on their walls, and it's lovely to see these posters up in clinical rooms, just reminding everybody to think about what they're doing before they use the couch roll. And initially we started with 6 GP practices. We've got over 60 practices in the county.
Oh, wow.
Yeah, so I decided to kind of just do a 10% of that. So started in January, and these guys have been involved every single step of the way. And so we are looking at the cost, so how much they used to order before the project started and how much they're ordering now. And there's a significant reduction already. And so we're rolling that out across the system. And so it'll catch on eventually.
Amazing.
That's my
an
hope.
amazing project.
Yeah.
Well done, Reggie.
May I ask a question?
Go for it.
So, do you know when because we're trying to get rid of the couch roll, and I think we've all got all our fingers and toes crossed that as people get used to it, the use will also drop because it's changing behaviour. That's always
right.
difficult.
Yeah.
But so that means that people will be cleaning the couch, between use. So you might have just asked someone to sit on the couch while you listen to their chest. So there's no risk of bodily fluid or anything.
That's right.
And in my observation, most people would use an antibacterial wipe like Clinell. Are you advocating they put gloves on to clean the Clinell wipes?
They don't need to put gloves on really because, so say patient comes in, sees the GP, they get assessed, say, their abdomen's been palpated, the chest listened to, etc. That doctor or the nurse hasn't really come into contact with any bodily fluids, and so we wouldn't say to put gloves on to clean because you're just really wiping the couch, you're not doing any decontamination, etc. And so no, we don't say to put gloves on when cleaning the couch.
So our Clinell wipes in the trust can be used without gloves, with the exception of the peracetic acid wipes, which are the red ones that we use to clean our commodes.
Yeah.
The green ones can be used without gloves now. I know that didn't used to be the case, but our green universal Clinell wipes can be used without gloves.
Yeah.
And that's not a problem.
The biggest thing, though, is to remember to wash your hands after you've done it all.
Yeah.
So, that is where we really need to focus, is not relying on the gloves and performing hand hygiene, either with alcohol gel or with soap and water. Because, again, as we're saying, gloves don't protect you, but your clean hands do. So after everything that you've done, you then need to perform your hand hygiene.
Absolutely. Oh, thanks.
So moving forward, how we're going to sort of try to progress this, our aim with our reduction is we're wanting to engage patients and the public, and we're also going to move forward with some targeted behaviours for staff groups and sort of specific areas and departments. And obviously we're all driving that forward in our own little areas, and we need your help. So if you want to get involved, we would really appreciate your help joining with the IPC Sustainability Group, attending our IPC Council meetings, which take place on the third Tuesday of every month, and that's just on Teams. It's not a face-to-face meeting yet. And any questions regarding this, I'll leave our acute team details, and what we'll do is on the podcast, we can put the details to contact Reggie and Leslie on there.
Absolutely. Anytime.
And yeah, as normal, our contact details in the trust are for Gloucester, we're on extension 6122, and for Cheltenham, we're on extension 3129. And I just want to say a big thank you for our guests joining today. Did you have anything else you wanted to add before we close?
The only little thing I wanted to add is to just remind everybody to also think about the environmental impact that unnecessary use of plastic items has.
Absolutely.
And we know that healthcare has a significant carbon footprint. And so if we can all make small changes, then we'll be helping our healthcare system to be more sustainable. And so let's think about what we're doing before deciding to use gloves or anything else really that's plastic. And I hope that everybody can join us in our aim to reduce this unnecessary usage of plastic items by 30% for the next year. And also just to say thank you to everybody for, hard work on the wards, care homes,
Absolutely.
GP practice, because we're all working really hard to do the right thing, and that doesn't go unnoticed. So thank you. And thanks to you for having us on today, Jen.
No, you're very welcome. Thank you so much for joining us.
And again, if anybody does have any ideas on sustainability and how, from an IPC perspective, we can improve things, then please come forward and let us know.
Absolutely.
Because sometimes we think we're not the ones that are thinking of these things. It's other people out there that have new innovations, new ideas, and we're always pleased to hear them.
Definitely. And any feedback on the podcast or any feedback for any future episodes that you would like, please let us know. Thanks very much, everyone. See you next time.
Thank
Bye.
you.
Thank
Bye.
you.